Stephen Dorrell knows the thing about how government works from the inside. He's a former Health Secretary and former Chair of the Health Select Committee, and he now chairs the NHS Confederation. Stephen, what an utter mess.
I don't think you've said anything yet, and this is unusual for the conversations you and I have, that I disagree with.
It had to happen sooner or later.
Well, we kept trying. I think there's only one additional point I'd make to all the points you made in your introduction, which is that this isn't just a matter of numbers and capacity. It's also a question whether a healthcare system can keep abreast of all the latest and best in world health technology if it doesn't welcome people from overseas to come and work in our healthcare system, and indeed ensure that people who train here spend some of their careers, if that's what they want to do, working in other people's healthcare systems. Science is a global activity, and it's not something that can be carried on in the UK without exposure to what's going on elsewhere in the world.
So, assuming that it is correct that the Prime Minister herself has vetoed this, I mean, you just wonder what the Home Secretary is for. Surely this should be a policy that the Home Secretary decides upon.
Well, I agree with that. I also think that within different sectors, whether it's health or, as you said, Greg Clark and his responsibility for industry, what we need to do is to look at where there are skill shortages, because if in the healthcare system, or indeed more generally, if there is demand for services that we're not meeting because we haven't got the right people, the people with the right skills to work in our industry, whatever sector we're talking about, then obviously what we're doing is slowing down our economy and making it more difficult for ourselves to win in an increasingly competitive global marketplace. So what you say is true of doctors. Actually, it's worth remembering when we talk about doctors and nurses in particular, healthcare professionals, it isn't only in the UK that there is a shortage of people with these skills. There's actually a worldwide shortage. It's one of the things that's increasingly being talked about within the global health community, is that not just in this country but across the world there's a growing demand for doctors, nurses, people with health skills, and an inadequate supply. So if we make it more difficult for ourselves to recruit in that marketplace, we're tying actually both hands behind our back in a way that I think damages our health outcomes, but also our global competitiveness.
What are you hearing from some of your members about patient safety being compromised if this shortage of doctors continues or gets worse?
Well, whether you're a manager or a professional working in the healthcare system, patient safety is top of your order of priorities. So you're obviously going to do everything possible to ensure that it's a basic rule of medicine: first, do no harm. So patient safety is fundamental to the delivery of these services, and everything possible will be done by both managers and professionals to avoid compromising patient safety. But you can't avoid the inescapable truth that if there aren't enough people with the required skills in the system, that it makes the task of ensuring patient safety more difficult. That's an unavoidable truth.
Well, at what stage, though, does that become safety critical? Because, I mean, we hear lots of circumstances where people say patient safety might be compromised, but when does it become critical? When do you have to say to the Health Secretary, well, we can't cope anymore?
Well, every healthcare professional is an independent registered professional, whether you're a doctor on the General Medical Council list or a nurse on the Nursing Midwifery Council list, and other professionals as well. And one of the professional obligations is you are individually responsible. This is not a collective system that can be lost in collective responsibility. You're individually responsible to blow the whistle if you think patient safety is being compromised, and that's one of the assurances that Jeremy Hunt, quite rightly, I think, has been very keen to emphasise, that people who see patient safety at risk have an individual personal responsibility to blow the whistle, and the system needs to ensure that when people do that, their own careers and their own personal interests are not put at risk.
Stephen, thank you very much indeed. That's Stephen Dorrell, Chair of the NHS Confederation. Well,